Our next speaker is Mrs. Kirsi Madi, who is Deputy Regional Director for CEE, CIS, who has an extensive career spanning across more than 2 decades, working in different fields, in the field of development, in the field of humanitarian action, in the field of external relations and intergovernmental processes, and working in these fields from different perspectives at the operational level, at policy level, but also at the level of coordination. In UNICEF, where she has been since 1991, she has held various positions in working in different countries, on different continents, and doing extremely challenging work, if I may add, successfully. And she is in this position as Deputy Regional Director since 2010. What I would like to add is that, as we all know, those of us working in this region, UNICEF has had strong impact in supporting governments, in supporting the civil society, and especially in promoting early childhood development, pushing forward this agenda. And I think we can see a momentum, not just in our conference, but we see a momentum in many countries in the region. We see a momentum globally. And I should say that Kirsi has been a strong advocate for ECD, and we are very, very happy that she is in that position, pushing this agenda forward, not only externally, but inside UNICEF itself, because recently we have heard the director of UNICEF speak very strongly in support of early childhood development. So it is my pleasure and honor to introduce Kirsi, and thank you so much for joining us.
Thank you very much for the very, very kind words. Well, it's a real challenge to be speaking after Kathleen, but I'm also extremely delighted to come right after her, because I think that she has put forward such thought-provoking and important issues for us really to take forward. So thank you again for connecting us. Dear colleagues, it is really and truly my pleasure, and I say it really sincerely from my heart, to be today with you at this really a landmark conference as we celebrate the creation of ISSA 15 years ago, as well as the 20th anniversary of the Open Society's step-by-step program. As most of you are aware, by very appropriate coincidence, this year is also the 25th anniversary of the UN Convention on the Rights of the Child, which is the most ratified human rights instrument in the world. And I think it is really a time for us to remind the international community of its obligation to guarantee that all rights for all children everywhere at all times materializes. And indeed, all children have rights, including the youngest, infants, toddlers, preschoolers. Just like any other children, the youngest children are holders of the full range of rights covering survival, development, protection, and participation. And this is really why I am here today, to highlight the importance of collaboration and partnerships in the progressive realization of the rights of our youngest citizens. To demonstrate the value of such collaboration, UNICEF's Executive Director Anthony Lake and Dr. Chang, Margaret Chang, the Director General of World Health Organization, issued last month a joint commentary on early childhood development. This commentary, which was published in The Lancet, underlines the significance of intersectoral approaches to early childhood development, encompassing education, health, nutrition, and protection, and the need to optimize brain development in the first early years of the child's life. On this 15th birthday of ISSA, I would like to reflect on the last 15 years and what they have meant for early childhood development. 15 years may seem like a short time period, but the first 15 years are the most significant in the life of the child. It spans the magical years within which an almost invisible embryo develops into a concrete, complete young person. A young person with knowledge, with ideas, with abilities, skills, attitudes, and rights. With strong foundations laid in the early years of life, this young person is likely to become a productive adult who contributes to society's human capital, prosperity, and stability. But the opposite can happen too. And too many children in our region grow up in poverty, experience or are exposed to violence, abuse and neglect, family dysfunction, or are placed in institutions. Families, and particularly the most disadvantaged and marginalized, get limited or no support in the care of their young children. Only very few children participate in preschool. The quality of education in the later years leaves a lot to be desired. Many children drop out or never quite make it, and some turn into antisocial and harmful behaviors. The significant causes for these outcomes can often be traced to the risks and deprivations in the early years of life. Over the past 15 years, we have seen an amazing explosion of research, which has changed dramatically how we look at the early years. 15 years ago, we focused on child health, nutrition, development, and education in isolation, in sectoral silos. We were not so convinced of the synergies necessary to support brain development or of the foundations for the physical and mental development of the child. We did not worry too much about the critical and sensitive periods of early development. We assumed that effects of social disadvantage or developmental difficulties could be remedied once children entered school. We think differently now. We know that all aspects related to survival, growth, and development of a child are intimately linked. For this reason, we are convinced that the families of young children need to be supported at the same time by health, nutrition, education, protection, and welfare services in an integrated manner. The past 15 years represents a significant period in the Central and Eastern Europe and Central Asia, a period of degeneration as well as regeneration of basic services. Many services that contribute to the survival and development of young children had deteriorated or even had been abolished as we started this millennium. These services are now beginning to re-emerge in new and innovative forms, albeit still sporadically. At the same time, we can see a worrying trend. Equity gaps between population groups have widened. It is widely recognized that family disadvantage is transmitted from generation to generation, and it contributes significantly to inequity and social disadvantage, not only for now, but for decades to come into the future. Today, our challenge is not only to consolidate effective health, education, and welfare services for children, but to deliberately and systematically ensure that the most vulnerable and excluded families and communities have access to quality services. And for this, we need joint effort to ensure the political commitment to allocate the budgets to invest in the early years of life, and to ensure that the most excluded and marginalized families benefit from these allocations. Today, scientific research is strongly influencing our advocacy and programming efforts for young children. The latest UNDP Human Development Report recognizes that investment in children of time, money, and other resources expand their choices further down the road, enhance capabilities, and lead to sustainable improvements in human development. The report emphasizes that particularly important are interactions with parents and caregivers which correlate with the child's later behavior, cognitive ability, and emotional development. In the landmark meeting at UNICEF headquarters in New York in April this year, 16 world-renowned neuroscientists and child development experts gathered together and presented the latest evidence on the impact of experience and environment on the brain development of a child. The day-long symposium left us with several key messages, of which I will highlight 3. First, in gestation and infancy, the brain consumes between 50 and 70% of all the energy absorbed by the body. Inadequate nutrition during infancy affects the structure and function of the brain in ways that are difficult to remedy later. Second, toxic stress occurs when a young child experiences violence, abuse, neglect, or enduring hunger. It produces high levels of the stress hormone cortisol, which can disrupt brain development, damaging lifelong health, learning, and behavior. And thirdly, the new research is exploring how parenting and caregiving may change the expression of genes in the brain. This, of course, has an effect on the child today. What we are learning is that changes in gene expression can affect how this child, as a parent, will raise the next generation of children, in effect, transmitting adversity from one generation to the next. To put our evidence to good use, we must understand when and how to integrate and deliver programs and services, especially for the most disadvantaged and vulnerable families, for greatest impact. During the early years, parents and primary caregivers must be at the center of our work because neurological and psychosocial processes firmly link responsive parenting to child development. And for this, all parents need some support. But some parents need all the support they can get. The Millennium Cohort study in the UK confirms that even in poorest households, when caregiving and parenting is responsive and nurturing, the effects on child development are positive. Equipped with all this new knowledge, we know that we have to get our programming right. Starting at pregnancy, when parents are highly motivated to do what is the best for the child, and then during the first months and years of life to support brain and psychosocial developments. Governments and civil society partners in the Central and Eastern Europe and Central Asia region has become more and more engaged in early childhood education, and the impact of this can already be seen. It is through these extremely valuable partnerships that UNICEF works to realize the rights of young children to quality learning opportunities, particularly for those children who are too often left behind, namely children with disabilities and developmental difficulties, children from ethnic minorities, children living in remote and rural areas, and children whose parents have migrated for work. In one of the concurrent sessions at this conference yesterday, my colleagues have shared with you the findings from a recently concluded multi-country evaluation on early learning and school readiness. And as all of you were not able to be part of that session, let me say a few words about this important work. We commissioned an external independent agency, Education for Change, and I believe the members are here today, to evaluate the results achieved in early childhood education, including the contribution UNICEF has made to those results in Armenia, Bosnia and Herzegovina, Kosovo, Kyrgyzstan, Moldova, and the former Yugoslav Republic of Macedonia. The evaluators conducted extensive desk reviews and data analysis, as well as field visits and interviews with local stakeholders to examine the results and our contributions to early learning from 2005 to 2012. Among the many positive findings of the evaluation were the following. Social norms increasingly embrace the importance of early learning, and national budget allocations have risen, as can be seen in Armenia, Kyrgyzstan, and Moldova. Together with partners, we have contributed significantly to developing new policy, legislation, and regulatory frameworks to govern the provision and quality of early education in countries such as Bosnia and Herzegovina and Moldova. Low-cost, alternative models of provision have been modeled effectively in countries such as Kyrgyzstan and the former Yugoslav Republic of Macedonia. And there has been a consistent increase, and sometimes significant one, in a number of children aged 3 to 6 who have had access to preschooling. In Kyrgyzstan, for example, children participating in early education programs has increased by 89%. The number of preschool facilities have increased substantially, particularly in the rural areas of Armenia, Kosovo, Kyrgyzstan, and Moldova. But at the same time, the evaluation identified challenges that will need to be addressed. And for this, we need the creative partnerships with you over the coming years. Let me highlight a few of those key challenges. First of all, the data systems across all countries continue to be weak and uneven. Few, if any, data are available on the impact of early education on learning and development outcomes. The lack of data is a major barrier to planning and management, and of course, to making the political case. While access is increasing, the equity gaps are also increasing. In Bosnia-Herzegovina, the private sector is expanding the provision. As is and can be the case in such situations, private services are often first absorbed by the well-to-do families, resulting in actually widening equity gaps instead of reducing them. Vertical and horizontal continuities between early education and other services for young children are limited. For example, an integrated early childhood education approach with cross-sectoral collaboration would allow us to identify as early as possible not only families at risk of having poor learning outcomes, but also their families. And this is particularly the case for children with disabilities and children who are victims of abuse. The continued decentralization of early learning services, which is very important, but at the same time it presents a particular challenge as municipal and local authorities lack capacity and struggle to transfer national policy advances into local service delivery. Advocacy and education cannot stop at the national level, but must strongly target all levels of governance down to the community level. Now, I have only touched upon a few findings of the evaluation here. A summary of the full evaluation is available with UNICEF colleagues for those of you who would like to have it immediately, and it will be, of course, shortly available in the public domain. Based on these findings, the evaluators made a number of very useful recommendations. And together with the national government and civil society partners, many of whom are present here today, UNICEF will examine, prioritize, and act upon these recommendations across the region. Since the early years of the millennium, ISSA has been a close partner with UNICEF in the region, collaborating to advance access, quality, and equity in preschool provision. In the last 3 years, ISSA has also partnered on one of UNICEF's newer priorities, strengthening the well-being of children between 0 to 3 years of age. And in a uniquely multi-sectoral way, we are collaborating to build the capacities of home visiting nurses in our region so that they can in the future more effectively help caregivers and families to improve their parenting skills and to provide a nurturing, safe, and stimulating environment for young children. And as and when needed, be guided to necessary protection and welfare services. As I said earlier, all families need some support, and some families need all the support they can get. The challenge has been to find critical entry point to reach all families, especially the most marginalized. Based on the 10 country situational analysis which we have conducted over the past 4 years, we realized that with the few exceptions, all countries in our region have actually functioning home visiting systems. Community or patronage nurses and sometimes even doctors deliver home-based services to pregnant women and families of young children. These health workers are trusted by the population and have access to almost all families. However, these visits in most cases still have a narrow medical focus and do not support the comprehensive development needs of the child, nor strengthen families' capacities to address their needs. Because of their presence, the existence of the system, and high acceptance by the population, home visiting nurses are well suited to an expanding role. They can potentially assess the physical and psychosocial risks in the growing infant surroundings. At the same time, they can build the knowledge, skills, and confidence of caregivers to provide a safe, responsive, nurturing, and stimulating home environment. With ministries of health, ISSA, and stakeholders from protection and education sectors, we are advocating for the reform of medically oriented home visiting services. We agree that with some fundamental reskilling, improved working conditions, and necessary support, home visitors can become partners with families to promote child development. Towards this end, we are providing technical assistance for the development of new legislation, the articulation of roadmaps, production of guidance materials, and piloting of innovative models and frameworks to monitor and measure results. With ISSA, in this context, we are working on innovative training approaches and a curriculum that will bring home visiting professionals truly into the 21st century. The effort is to incorporate the scientific findings I mentioned earlier into comprehensive multisectoral programming for children. This way, families can be supported. ISSA has special expertise in the capacity development of professionals working with young children and their families. Building on this experience, our agencies, together with other partners, have jointly developed prototype standards for comprehensive home visiting, early childhood health and development services. These standards will enable home visiting services to provide the basic support to all families. Additionally, families that need more individualized support will be linked by home visitors to relevant welfare and protection systems. And in partnership with local early education services, home visitors will also facilitate young children's transition from home to preschool. Both ISSA and UNICEF are among the founding members of the Early Years Regional Alliance for Central and Eastern Europe and Central Asia. We have been working together with the Open Society Foundation and the Save the Children to create a strong and unified voice for the well-being and development of all children during the first 8 years of life. We have much to do to increase public awareness about the importance of early years. And this is a journey that no one can take alone. Today's complex political challenges require partnerships across sectors and societies to achieve equitable and sustainable results for children and to realize the promise of a world fit for children. We need these voluntary and collaborative relationships, bringing together our various organizational strengths. And through focused engagement and working together, we can achieve so much more and produce the results we need for a thriving and productive next generation. One of the first tenets of the ERA manifesto, which is currently being drafted, is early childhood is a public good and a public responsibility that requires strong coordination among public, private, and civil societies. I do hope that several of the agencies who are participating in the conference here today will join the Alliance so that we can together catalyze a groundswell of action for early childhood development in the region. Before I close, I just would like to reflect in a few words on what the next 15 years can bring. 2015 marks the end of the era of the Millennium Development Goals. The post-2015 development agenda promises to establish new and ambitious goals. And certainly much remains to be accomplished with regard to young children. The key to change is that all families, governments, policymakers, program managers, general public must be made aware of what we know today about early childhood development and early learning. Operationalizing the science of ECD into effective programming and reaching all children, particularly those who are likely to be left out, has to become central to our all efforts. As the post-2015 development agenda takes shape, the global community has an opportunity to assess its progress in reducing poverty, in expanding growth, prosperity, sustainable development. And we have an opportunity now to do just that by translating the scientific knowledge into practical solutions to change the lives of millions of children. Over the coming 15 years, this is what we need to focus on if we want to give every child the best start in life, if we truly want to work for the reduction of equity gaps, and if we want to sustainably enhance the quality of life in the countries where we work, and if we want to ensure all rights for all children at all times, everywhere. This is something we can accomplish only together through partnerships such as the one we are celebrating today.